whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. Today we're talking to Dr. Igor Ivanecky. He's a family medicine physician and has been working as a civilian doctor on Canada's military bases with Calian since 2021. He currently works in Trenton, Ontario, where he started about 1 year after finishing his residency. Dr. Ivanecky, thank you so much for joining us today.
Thank you for having me.
So give me the backstory. What did you do before medicine, and then how did that transition to working with Calian and being the civilian on the bases? How did that go?
So I was an electrical engineer before I went into medicine, and how I got into medicine is sort of like a long, convoluted answer. So the short of it is I worked for a medical device company, and I was doing medical device clinical research, and that sort of led me to wanting to go into medicine. And I ended up going to McGill for my undergrad, and from there I went to U of T for my residency training in family medicine. I also met my wife now back in med school, as a lot of people do, I guess. And we had two kids, and during my residency training, I actually wanted to be a rural family medicine physician initially, but then some family health concerns sort of crept up, and I knew I had to sort of not venture too far off from a sort of semi-residential type of place. So I ended up specializing in addiction medicine as a subspecialty in my family medicine residency training. And I kind of finished residency right at the cusp of like 2021, right at the beginning, right at the height of sort of the pandemic, which was kind of a weird time to finish residency. I started working kind of like odd jobs with kind of walk-in clinics and that sort of thing. And I also started working at a addiction treatment place called Gateway, which specialized in trauma and addictions care and sort of inpatient for first responders and military members. And so that's where I sort of got interested in working with the military population. In terms of Calian, that was kind of random. So I was working with the over at Gateway with the military members. And one day I opened up the Canadian Family Physician magazine, and there was like an ad from Calian to work with the military. And I was like, that's interesting. I'll just give them a call and see what this job is about. And I talked to the recruiter, and everything sounded really nice. And I think what sold me at the time was that they said, just try it. If you don't like it, there's 2 weeks to give us notice, and that'll be it. You can kind of walk away. So I was like, what do I have to lose? And I tried it out, and I've been working with them ever since.
All right. So it's not like you're getting conscripted or anything, it's like a pretty low committal contract, and you're like, okay, that sounds fun. Let's try this out. How did they actually pitch it to you? What was the thing that drew your interest when you were talking to Calian?
Well, they were kind of saying you can just try it out. It's all 2 weeks, and then you can quit if you don't like it. It's very flexible. You can choose to work part-time or full-time at the start, whatever you kind of want, even 1 day a week if you wanted to kind of just dip your toes in. And they're like, it's a very motivated population. They're all generally fit and healthy, and they all have basically medication that's paid for through their plan. They have physio that's paid for. They got access to specialists. It's a big multidisciplinary team in the clinic. So they have a lot of support, a lot of help. And they said it's going to be pretty. I was actually kind of wondering, I was telling them, am I going to be kind of am I going to lose my competency because there's going to be, everyone's just healthy? And they're like, no, it's going to be okay. And so it wasn't, at the end of the day, it wasn't as like there. You still see pathology and you still see a lot of like things, but the population is like kind of like 18 to like your kind of at the oldest would be like your 60-year-old. No one older than that, and so people are generally a lot more healthier, I guess, than your general population. But yeah, that was the sort of pitch. It almost sounded like I was going to be like paid hourly for doing very little work. There is work. You're going to be busy, but it's enjoyable and rewarding work. That's for sure.
It sounds like a little bit of how I felt after graduating. I finished in 2019 and I was sort of floating around doing the odd locum here and there, doing some walk in clinic stuff. I wound up going into tech and the world of startups versus going into the paramilitary side of things. So you've been here for several years now. Clearly you liked it. What's your favorite part about the job so far?
My favorite part is probably working with the military members. It's pretty rewarding. They get to go all around the world, and you're sort of supporting all those missions, and a lot of things that, like, I was kind of naive before this. I thought, like, the Canadian military were probably not up to much, and then you're working in it, and they're just going all over the world in places that, like, you don't even hear about in the newspapers. So you get to kind of sort of indirectly know about all these like cool missions and places, and yeah, that's a lot of fun.
How much top secret, cool, classified stuff do you get to hear about just as part of the grapevine and talking to your patients?
I'm not at liberty to say. No one's supposed to talk. So yeah, no one's supposed to talk about it. It's not supposed to be talked about. It's need to know basis kind of thing.
We'll edit that question out. We'll pretend like that never happened.
Yeah, but they have to let you know, right? Like they're like they'll have to let you know like where they work, because there's the whole like travel medicine aspect of things when they go in some kind of like remote place and they come back with some kind of symptom, and then they have to tell you, and then you're like, whoa, I wonder what this could be, because a lot of times, like, it's not something that we learn in like medical school or residency, but there's always help and always support.
Yeah, I guess you got to be up to date. You're like tropical diseases and all that sort of like weird and wonderful stuff that you might pick up abroad.
Yeah, but there's always an on-call specialist that you can just, like a military specialist, like internal medicine and whatnot. If you have any questions, you just pick up the phone and call them, and they'll just like talk to you right away. It's very different than the consults you do as a resident in the hospital, where sometimes the consultants are kind of like, giving you a hard time. These guys are always happy to like chat and answer the phone.
The good work environment, good team.
Yeah, that's right.
What are the patient cases typically like? I'm envisioning a whole lot of MSK and that kind of stuff.
It's a lot of MSK and a lot of, like, minor traumas and that kind of thing. The typical kind of stuff that you would expect from like people on courses where they're jumping around and swinging from ropes and parachuting and all this kind of stuff. Um, and also mental health as well. You get a lot of that, and then you still get like your cancers and your weird like autoimmune conditions and the other stuff that you see in a typical practice. So you still get a lot of that stuff. And sometimes, with these members, military members, they move around quite a bit, like going from base to base. And so you'll pick up things that got just lost to follow up, or they'll come in with something that, like, clearly they should have been seen for like a long time ago, like a big like hard lump or something that's been growing for like a year, where they were just like, I was just going to tough it out, that kind of mentality. And they come in, you're like, whoa, you should have like come in a long time ago. So you still see some pathology. And
I'd get that a lot with like my patients that were farmers. Like they're just so tough, and they tend to, as a consequence, let things linger for a little while too long. You probably get a little bit of that same vibe with the tough young crowd.
yeah, so that tends to be the case. Like when people come to see you, it's usually like things are pretty bad. No matter like what the presentation is, it's usually like, you get the pretty advanced, like, yeah, it's whenever they're decompensated and can't do things anymore. Because the other part of the job is you're kind of there. You give them what are called like medical employment limitations. It means that medically they can't do certain things in the military, and that has like repercussions for their like career advancement and this kind of thing. So they're kind of like their careers get put on hold while they have these limitations, and so oftentimes they don't want to come in because of that.
So you're playing sort of that role of like occupational medicine as well, like almost that WCB side of things of like, okay, how did things go at work? And it's all work related.
That's right, and that's the other part of the job. There is a lot of that occupational medicine, which you kind of there's no formal training. There's like a 90-page document from like 10 years ago that's circulating around that like some new doctor like created, and people have been like adding to it, but it's sort of like informal. And so most of the training happens like on the job, and that's the nice thing about working in this place. That's the other. So you were asking like, what my favorite part of working here, it's the team that I work with. I really enjoy like working in this multidisciplinary team, and like honestly, everyone has an open door policy where, whatever question you have, you go in and you talk about cases a lot, brainstorm. We have some formal sort of like rounds, but we also do a lot of like informal, just like talking and about different cases and things. So there's a lot of help, a lot of support to get you through not just the occupational medicine, but also the just medicine in general, which was another thing that I quite liked after graduating from residency. It's like a little bit of extra support.
And so the bases are across all Canada, like they're all over the place. What's the medical team like at these different places? I imagine there's some variance between the two, but are they typically like how many doctors, civilian doctors like yourself, would be practicing on one base, or how many internists or surgeons or other types of colleagues would you be having your daily or weekly rounds and discussion over patient cases with?
So it varies quite a bit base to base, and time to time. So I can tell you like there's some times when like we've had, I don't know, probably like 10 physicians, and that'd be a mix of like Calian physicians as well as the military physicians, like family docs working at our clinic. And there were times when like we'd have like 2 or 3. We were like a skeleton crew running because everyone got deployed, and so it really varies. And then we have like physiotherapy, occupational therapy, we have social workers, psychiatrists, and then the specialists. It depends base to base who they have. For example, our base, we don't have any like ortho or any other specialists other than psychiatrists. But the nice thing about the military is because they are the patients, they are Blue Cross funded. The specialists tend to give them sort of a preferred treatment in terms of like wait time. So they end up being seen a lot quicker than you do in the civilian side. And so, you'll get even imaging and like ortho referrals or any specialty referrals kind of like get seen like probably half as fast.
Very cool. So there's less of that frustration just with the system as most of us out in the community are experiencing. It's just a little bit more well-oiled of a machine there.
That's right. Like I never really have to, like working here, I never have to think about, my patient not being able to afford like drugs or physio or something. It's just, they just get, it's never a thought. So it's kind of nice from that sense.
The day-to-day, like, like when you start your day, walk us through it. How does this actually work?
Sure. So the days typically start at 7:30 in the morning, and it starts with parade, which is it's a fancy way of, I guess, of like a walking clinic. So 7:30 usually to like 9:30 or 10 will be the walking clinic where people from the base, they just kind of come in and report with whatever like acute things they're having, medical issues and concerns. And so the whole team is kind of seeing those people. And when you finish with that, you start having your booked sort of patients, and that goes from around like 9:30 to about 12 o'clock. Then you can go for like your 1 hour lunch break. And after that, you see patients again for another 2 hours, and then you get usually like 2 hours of admin time, and that's all. And you get paid hourly, so you don't worry as much about um, you know no shows, and you don't have any overhead, so you're really just you're just focusing on patient care and nothing else.
Very cool. That's like one of the biggest gripes people have in the community is just the amount of unpaid admin work and just that huge burden. And so that's sort of no longer a problem for
It
you.
was one of the nicest things of working here. It was just that, like, I just do my work, seeing the patients, and that's all I need to care about. And at the end of the day, I just put in my hours, and it's always the same, but you just keep going through those motions, and that's it.
And did I hear you say you get to sit there for 60 minutes and just enjoy your lunch?
In theory, yes. In practice, no.
Okay, so that's similar.
So like I end up seeing patients through the lunch hours, and there's always someone, and no one's kind of forcing me to do it. It's just I want to call patients about results and whatnot. I don't want to just keep deferring it, because you can't just say well, book this person when I'm next available to review it. But I just end up doing it sort of on the fly, and so it takes up a lot of times my lunch hour. Sometimes I'll see some patient that came on sick parade, but I'm their regular sort of physician, so I just slot them in later on or something. So
duty calls, I guess. Okay, so some parallels between being off base and on base, still working over lunchtime sometimes.
But I will tell you, so when you're kind of when 4 o'clock comes and you finish, you're done. There's no more. A lot of times at the beginning when you start, you can't even take the EMR home, or so you just finish your day and that's it. There's other doctors that come on call if there's any kind of on-call work to be done. So you're not working evenings, you're not working weekends. You kind of just do your 7:30 to 4, and that's it. So that's the other nice part, is that there's you kind of just you usually just work whenever you just during the hours that you're given. I mean, in practice, I have I've tried in whatever after hours. That's, I guess, a bad habit from from all the other jobs, but it's nothing close to what it was working in the other places that I've worked. It's fairly manageable, and actually you can finish everything during your allotted hours. And the other nice part is that the clinic managers are very flexible. So if I'm sometimes if I'm just running behind for a couple of days, and the admin stuff is building up, I'll ask hey, can I have half a day of admin, and they'll find it and they'll put it in, and so I can catch up.
That is a luxury, just being able to take time for admin. I'm getting jealous over here.
I know. It's a pretty sweet gig, I have to say.
Tell me more about the work-life balance. So you get there, you clock in at 7:30, you're out of there by 4 o'clock, pretty much on the nose. What is it? 5 days a week, just your normal 40-hour work week? Is there any overnight or call?
Pretty much Monday to Friday, and I mean, you can be on call if you choose, but you have to be at least basic aviation medicine certified, and then it opens up options for you to have what's called a duty phone, and essentially you're on call overnight and on the weekend, and it goes 1 week at a time, and that's sort of for any kind of acute emergencies. A lot of times you'll get called from up north in random places and stuff, and where they don't have a lot of resources, and so you're trying to manage things acutely with little over the phone, with little sort of resources, and but you can always get the patients kind of shipped to a center, and there's the routine every province has its own transports that they can do for acutely unwell patients, plus so you can access that, plus on top of it the military will literally fly planes or whatever, helicopters, places to get people out if they like acutely unwell. So
Very cool.
yeah.
What's a typical patient encounter like? Like how many patients are you seeing a day? How long does an appointment run for?
So the other nice thing about Calian is that it's actually pretty generous in terms of like, or not just Calian, but anyone working at the bases, is that the patient time is pretty generous. And so your average encounter tends to be about 30 minutes in length, and more complex encounters, mental health, they can be up to 45 minutes in length. You get to see your volume is half of that of like a regular sort of like typical clinic. So you get to see somewhere between like 12 and 14, 15 patients a day. The downside is that there is a lot more paperwork. The military, they love their forms, and so you do end up filling out forms anytime people are deploying, or anytime you're giving them any kind of like administrative like limitations or medical limitations or whatever. So there are a lot more forms, and you spend more time on that with every single encounter, sort of. But they do give you the time, and it's quite generous.
Oh, that's cool. So the morning is like the walk-in clinic style where you're seeing patients just ad hoc, whatever's going on, but you're not practicing that like turn style, just bring in the next cattle, bring in the next one as fast as possible, trying to get everybody through the door. You can actually like take your time and get invested in what's going on.
That's right. And you can ask, like, if you need like more time for more complex encounters, you can ask for that. If you want to have like, team rounds because you're seeing a complex patient, medically or administratively or whatever, it doesn't really matter. You can get the whole team, more seasoned clinicians, to kind of like come together and get the whole like the entire team to kind of like chip in and help out. So it's nice.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. So tell me more about that side of it, because I understand you've now completed your basic aviation medicine certificate. What does that entail? That sounds freaking cool.
Yeah, so that's the other perk, is that even though you're a civilian provider, you can sometimes do some of these courses that usually are reserved for the military members. So one of those was the basic aviation medicine course, which basically teaches you the medicine side and the occupational side of managing aircrew and pilots. And so you go, it's like a 2-month course that we went to like Toronto for. And it was kind of like paid. You get paid as if you were like working during the whole time, like full time. You get, your hotel and accommodations and meals and all that stuff covered too. And you're just kind of like, going to see all kinds of like cool stuff, like hypobaric chambers. All these like specialists are coming in, teaching you like, all this like weird medicine you never learned in med school or residency about what happens in like hypobaric environments, like to like the ear, the heart, and like whatever, like all the different organs, so that you can like figure out how to treat and manage like aircrew and see if like decide if they're like safe enough to fly. It's a lot of so that course is, it's sort of like almost like being back in med school, since it's a lot of theory. And a couple of field trips to some cool places that the military has, where they do like training on the pilots and whatnot. The
Are you
course
allowed to tell us about those, or is that classified too?
no, it's not classified, but you actually get to experience it if you take the course that can come after that, which is the flight surgeon course, and that is a month-long course where for a couple of weeks you get to fly with air crew. So that could be like the SARTECs, which are like the search and rescue like operations that the military has, where you go all across like Canada to do that. You can fly with them. You can fly with like other squadrons. Sometimes you can even fly with the I forget what they're called, but they're the ones that do like the stunts at the air shows. They usually try to make you like pass out though while they're like apparently while they're like have you in the cockpit. So you
You
get to
got to
like
mess
go.
with the new guy a little.
That's
Of
right.
course,
That's
of
right. That's
course.
right. You get to go. Everyone gets to go into the giant like centrifuge where they spin you again. They usually spin you until you like pass out. Um, and you know you get to experience like low oxygen environments and how it feels to have like hypoxia to the point where you're about to pass out or you do pass out. And so you go to these. I think they're like hypobaric chambers that they like that the military has. They have all these like all this like all these fancy like gadgets and things. It's almost like out of the movie. Like they have this like big facility in Toronto. It's kind of like hidden, but yeah, it's where they developed like the first G suit, which is what the pilots wear so that they don't like it kind of like squeezes their like legs and their torso to keep the blood in their head when they're like doing the high G maneuvers. So the first G suit was like developed in Toronto in secret, and like it's still there, and that's the place that kind of that has all this cool stuff, and still to this day does all this like cool research on like aircrew and pilots and whatnot. So you get to see it.
That is really neat. And then I understand there's the dive medicine aspect too. This is another one of the unique parts of working on base and working with Calian here. Is this unlocks another one of these like unknown to the rest of us facets of medicine. What is dive medicine all about?
So it's sort of like the flight surgeon part, but the flight surgeons they deal with like aircrew, and the dive medicine certified physicians they deal with like divers and people that go like underwater. And it's the same kind of process as being a flight surgeon. I don't know the details of like what you get to do, but the people that have done it all tell me that it's a lot of fun and that I should go for it if there's an opportunity.
And then how does that work in terms of the opportunities? Like at some point, do you just have seniority and you qualify to start doing these cool things, or are some of those doors open at all
Some
points
of
in
those
time?
doors
You just
open right
choose to
away.
do it.
It all depends on like the operational needs of the base where you get your job. So like there was one Calian physician. She was like a family doc for something like I think like over 15 years, and she just started working with Calian in November, and like she never worked in the military environment before, and she was on the basic aviation course with us in like January. So yeah, there was a need, so
Quick
and
turnaround.
she was there, so they filled it.
And then what does the career trajectory look like? Like, is there sort of a hierarchy or is there a ladder to be climbing? I know, like, if I'm being a physician in the community, you sort of have your position and you see patients, and there's not like a whole lot of room for advancement unless you sort of switch completely what you're doing. How does that work if you're working on base?
So it's sort of similar. I mean, there's a lot more advancement if you're a military physician, but I would kind of say that like their advancement, the more they advance in their careers, the less like actual clinical encounters they get to do, and it's more about doing more admin and admin. So if you kind of like medicine, like seeing patients and doing patient care, you would probably hate that. This is one thing that
Yeah.
as a Calian physician you get to keep doing. And these courses, by the way, so like either the basic aviation medicine or the flight surgeon medicine course or basic aviation medicine, those are sort of like advancements in and themselves. So when you get certified, you can start seeing a new patient population, and it's more sort of on the occupational side of things, but you get to do more occupationally in terms of medicine, and it also comes with like a pay raise. So you get remuneration for doing it, and again you get other perks. The other perk would be like I was saying, like carrying the on duty phone, so you can kind of do work after hours and weekends if you choose so. So it's all these things are optional. No one's going to force it on you.
How does it work? Because you're not like enlisted, you're not going to get deployed anywhere. When it comes to, you're currently in Ontario, did you get to choose that specific base, or do you get to pick from openings, or do you get kind of voluntold where to go?
You get to pick from openings. So like if you contact Calian, you can tell them like I kind of want to work here, and they'll tell you if there's an opening. There sometimes they'll tell you that there is no opening when clearly like that base has no people, and literally the opening will come like later on. But if you kind of have your heart set on a specific like location, where there's a base, you can usually, even if there's no opening, all you need to do is just wait for a couple of months, because the military physicians, they get moved around so much that usually there's going to be an opening fairly soon, even if there's not one right now.
Right on, right on. Well, I guess, do you have any advice for potential new grads or physicians who are looking for a switch up here? It sounds like you're thoroughly enjoying your position, no regrets, loving it all the way.
Yeah, I mean, I don't. My only advice would be for people just to, when you start off, don't commit to anything. Explore around. Like people always say, like, I tell everyone like locums are a great opportunity for that reason, is that you can kind of like see how a place kind of like functions, and if you like it, you can kind of like dive in. And that would be the advice that I would give to people is, I mean, here there's no locum, but you can kind of like, the nice thing about this job is that you can kind of try it out and see if you like it. My experience was that a lot of times the way clinic or your the way the like the patient population and everything else in the clinic, the way it was presented early on, and the way the team functions is a lot of times different in practice than what you get told. And so you end up sometimes having surprises that are good and sometimes surprises that are not so good. And that's why it's good not to commit to anything early on, especially like the nice thing about being a physician is that you can kind of choose to work anywhere you want, and you have so much opportunity. And so, don't commit yourself, especially when you're just starting. Find a place also that that is willing to like give you good support in terms of like more senior staff, where you have a very like collegial team and people are willing to like help you out. There's even after residency, there'll be a lot of things that you still don't know. And even like, years on out, you'll still be learning new things every day. So it's good to have that supportive environment. And yeah, don't jump in, just search around until you find it. And once you find it, then you can take that plunge.
Yeah, you'll know, right? Like once that specific spot where you find that good fitment hits, right? So you just not being afraid to like test out some different waters.
That's right. But
try out a few different things.
That's right. I will kind of say like there was such a funny difference between like when I was an engineer, when I was applying for jobs, I had to like sell myself. In medicine, it's like the only question is kind of like, do you have a valid like license? And after that, they're like selling themselves to you. So like, so you do have a lot of like
the number of clinics I've worked at with no contract, they haven't checked my credentials. They just sort of, you look like a doctor, they take your word for it, and they're desperate. It's crazy how that's the state of the system right now.
That's right. So that's right. So make it, as a new grad, like make sure that you're happy with what you have, and you can find the kind of like work like balance that works well for you. And that was the other thing for this job, right? So originally I thought I was just going to be like working. I wanted to work like a busy rural practice nonstop. And then when I had my kids, and when they were like, they're still toddlers and little, I kind of decided to like, like working just, Calian sort of like 7:30 to 4. That's good enough for me right now. And I get to like see my kids, and they're pretty soon they're gonna get older and they're gonna have their own things, and I can add other responsibilities on, but like I have that flexibility to kind of like see them and still make a competitive wage, and so it's pretty great.
Did you have the opportunity to do part-time stuff, or is it sort of you're all in full-time or nothing? Could you go sort of in that middle ground?
I started part-time. Yeah, I started part-time. And there's some people, actually, a lot of people sometimes they'll tell them like, all we have available is like 1 day a week. And so there's been some people that wanted to work full-time, and they started off with 1 day a week. But I mean, if you're interested in working more, it won't be long before that opportunity becomes available.
It'll grow on you, it sounds
Yeah.
like. Very cool. All right. And then, so parting wisdom for the audience out there. What is Dr. Ivanecky's top wellness tip? How do you keep yourself going? How do you keep your head level?
Yeah, that's a great question. You know what? Like my top wellness tip, I used to have all these wellness tips until I had my kids, and then it just became one. Then it just became like try to get like 5 to 6 hours of sleep if you can, and that's like that's the threshold right now that I'm trying to meet. So
Just hit that basic minimum function. Don't go back to like the 3 to 4 hour
That's
med
right,
student
that's right.
sleep load. Awesome. Okay, well, Dr. Ivanecky, thank you so much for joining us today. Really appreciate hearing about your experience and the insights working on base as a civilian physician. It sounds like a really cool job opportunity. I appreciate you
My
taking
pleasure.
the time
Thank
to
you
chat.
for having me.